It's time to take a look at some of the superficial muscles of the thigh. So I'm going to start from the hip and move down toward the foot. In the pelvic region is the iliacus right here, and the iliacus has its origin on the crest of the ilium, inserts down into the femur area and acts as a flexor of the hip. Also right beside it is the psoas major. It's also a hip flexor, trunk flexor, thigh flexor, however you want to look at it. As I proceed downward in the thigh, the longest muscle on the thigh is the Sartorius. You can see it going from the anterior superior iliac spine down to the medial aspect of the knee. When a person is seated, this muscle is a muscle that helps them cross their legs. If we continue medialward, we see the Pectineus, we see the adductor longus, the adductor magnus, and the gracilis. The adductor longus, magnus, and gracilis, these are all adductors of the thigh. The Pectineus is a flexor of the thigh. The muscles that make up the quadriceps are the vastus lateralis, the rectus femoris, and under is the vastus intermedialis and the vastus medialis. All of these muscles move by ligament through the patella and then attach down into the tibial tuberosity of the leg to provide for leg extension. While I'm on the front of the leg, I'll continue a little bit further down. The Tibialis Anterior is on the front of the leg, and it extends down under a retinaculum, as you can see, and then moves medialward. So it is a dorsiflexor and an inverter of the foot. There's an extensor muscle on the front and side of the tibia that also passes under a retinaculum and then aids the toes in extension. On the underside of the foot is the plantar muscle, and that would aid the toes in flexion. From a medial view of the thigh is the gracilis. It is an adductor muscle of the thigh. One can again see the Sartorius muscle. And looking at the lower limb from the side, one can visualize the Gastrocnemius. Gastro means belly, and it's evident that when I look at Achilles tendon going down to the calcaneus, that when this muscle here shortens, it causes the foot to plantar flex downward. The accessory muscle under the gastrocnemius is the soleus, and it is an agonistic muscle to aid in plantar flexion of the foot, going up on one's tippy toes. Lateral aspect of the thigh is the Gluteus Maximus. It's an extensor of the thigh. And here is the Gluteus Medius. And as I've studied this model, I'm thinking that this right here, this is the tensor fascia lata. And this is what gives rise to the iliotibial band that extends down to the knee. These would both be abductor muscles, Gluteus Medius and TFL. If I move back around to the posterior aspect of the thigh, there is the biceps femoris, the semitendinosus, and then a large muscle underside, the semimembranosus, and then more medialward, the adductor magnus, and then the gracilis. The biceps femoris, semitendinosus, and semimembranosus make up the hamstrings. And these involve flexion of the leg at the knee. Lateral aspect of the leg, the view that I have here is of the Peroneus Longus, sometimes called the Fibularis Longus. And because it extends behind the lateral malleolus, it is a plantar flexor of the foot and an everter of the foot. That concludes the lower extremity.